y'all. Our NCLEX question of the day today says, the nurse is planning care for a 3-year-old client who is hospitalized. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. So we're gonna have multiple correct options here. Option 1 says to maintain the client's home routine as much as possible. This is gonna be a correct option. That consistency is gonna help this client feel more comfortable while they're in the hospital. Option 2 says to demonstrate medical procedures to the client using a doll. Again, this is going to be a correct option. We definitely need to be explaining things in a developmentally appropriate way for these clients. Option 3 says to ask the parent to bring the client a comfort item from home. This is going to be a correct option. Something like a familiar blanket or a plush toy would be a really good option here. Option 4 says to use medical terminology when describing procedures to the client. This is going to be an incorrect option. Our client is 3 years old. They cannot understand medical terminology, so we need to be explaining in a way they can understand. And then option 5 says to encourage the parent to remain with the client as much as possible. This is going to be another correct option. That parent is going to provide comfort, familiarity for the client while they're in the hospital, and that can be a really scary time for these kiddos.